Hi, my name is Thomas Bogdanovich, founder of PharmAssess, where we're building software to help transition pharmacists toward their expanding scope of practice and offer care on a large scale. Licensed pharmacist in May of 2021, having won a National Pharmacy Research Award in 2020 with over 4 years experience in pharmacy and past startup experience, I see an enormous opportunity for community pharmacy. PharmAssess is led by an experienced and passionate pharmacy team consisting of a product officer with experience at Green Shield, a licensed pharmacist practicing for over 6 years, and an executive pharmacy strategist with over 35 years experience in the industry. Our CTO with 4 years experience at Facebook and Instagram, having built and launched an app himself, leads our development team, which is comprised of a full stack offshore team and a 5-person internal team. PharmAssess is uniquely partnered with a nationally recognized medical information provider, MedSask, and an industry-leading pharmacy software vendor, Pharmacy Access Solutions, which allows PharmAssess to integrate its software seamlessly into pharmacies across Canada. Over the past decade, pharmacists' scope of practice has seen substantial evolution, increasing the public's access, interest, and ability to tap into clinical services like medication reviews, smoking cessation programs, and treating vaccinations. Pharmacies are reimbursed for these services by provincial governments, so there's revenue-driving incentive to perform as many as efficiently as possible. And since 2007, Canadian pharmacists have been gaining prescribing rights from province to province, allowing them to assess and prescribe medications for common diseases like eczema and urinary tract infections. Implemented in 8 provinces, minor ailment prescribing is trending, and understandably, its demand is increasing, allowing pharmacists to prescribe for more and more conditions. Expecting to launch in the second quarter of this year, pharmacy minor ailment prescribing is finally reaching Ontario, where about half of the Canadian pharmacy market is, marking a huge shift in the evolution of pharmacy. So instead of waiting in line at walk-in clinics, people will conveniently and easily go to their nearby pharmacy to get their minor ailments treated with a prescription given on the spot. But unfortunately, pharmacists struggle to provide such advanced clinical services, as Canadian data shows over 86% of pharmacists have insufficient time, they lack confidence and support, and they state that they have excessive competing priorities in the workplace. So to enable pharmacists to embrace advanced services, the solution is a diagnostic software tool providing clinical decision support to efficiently manage minor ailment prescribing, amongst many other advanced clinical services. With remote patient access, patients use the PharmAssess patient portal to select the pharmacy of their choice and request a minor ailment assessment or an appointment through a patient-facing website. They complete an online guided ailment assessment form, HIPAA compliant and powered by machine learning, or schedule an appointment that the pharmacy customizes using PharmAssess. And this is an extremely helpful and timely solution to automate COVID vaccination appointments at pharmacies, where pharmacists are currently overburdened with limited solutions in place, forcing owners to actually employ full-time staff to solely work on scheduling appointments. So pharmacists receive requests for appointments on their dashboard, which seamlessly integrates with their in-store management software with PASI. Pharmacy Access Solutions, our partner. The appointment system tracks inventory in real time to ensure correct allocation of vaccinations, and the minor ailment system is sourced using credible, up-to-date Canadian guideline medical information from our partner provider, MedSask, and can also be used on walk-in patients. PharmAssess automates appointment booking, guides patient assessment, recommends provincially recommended treatment options, and automates documentation. In fact, early pilot trials have already shown that the PharmAssess assessment tool cuts down minor ailment workflow time in half. This increases pharmacists' incentive to engage in this service, as now it's time efficient, allowing them to treat more patients and earn more revenue, since assessing is a fee for service. In fact, typical stores can save upwards of $1,000 per month, given an average store that conducts 20 assessments per week. Clinical decision support programs currently used by pharmacies for minor ailments are UpToDate and RxTX, which provide evidence-based resources. MedSask provides an online PDF entry system that can also guide patient assessment, while PharmAssess outperforms industry standards with interactive diagnosing, built-in documentation, and ability to identify best treatment options, giving it a strong competitive edge. The solution is sold as a tiered monthly subscription for pharmacies at $154 per month, including both the appointment module and the minor ailment module, with flexible pricing packages for high and low volume stores. Looking at the 10,000 pharmacies across Canada, phase 1 of launch targets Saskatchewan, 400 pharmacies, where a product is set to be piloted in 7 pharmacies next month. The appointment module will launch with our partner, Pharmacy Access Solutions, targeting over 100 pharmacies across the province before expanding nationally. As our appointment module gains traction, a unique partner banner network will facilitate uptake of the minor ailment solution of a target of 20 pharmacies. Phase 2 captures the Ontario market of 4,500 pharmacies for the minor ailment solution, where our partner network expedites uptake to reach a target of 50 trial locations in July. Phase 3 of the minor ailment solution enters into the chain pharmacies, where we've already engaged with 2 major chains, and also targeting the 7 other provinces for minor ailment module, the other 4,000 pharmacies in Canada, where uptake will be expedited also by our channel partner. Winnings will be used to fund a promising partnership with a nationally recognized pharmacy association, yielding a substantial increase in onboarded locations. We also plan on patenting our proprietary algorithms, among other requirements set with our channel partners. PharmAssess leverages technology to enable pharmacists to provide these advanced services. PharmAssess, as an untapped resource, will now maximize this opportunity, benefiting society at large with more accessible, convenient patient care. Thank you.
Great, thank you very much for that. Great presentation, and we'll kick off our questioning today with John. John, do you want to start off?
Great, thanks, Jennifer, and thanks very much, Thomas, for the presentation. Talk to me a little bit about the rollout. I'm thinking in particular in terms of the way in which you're going to bring new pharmacies and or chains on board. Do you have plans for a sales team? Or are you going to strictly use marketing efforts? What are your thoughts around that?
Yeah, so that's a great question, because just like any technology that requires, thorough regulated solutions, requires very well knit partner channels to actually roll this out to. And thankfully, we actually have been speaking with the Canadian Pharmacy Association about our solutions, the Ontario Pharmacy Association about both of our solutions, and actually those two are targeted partners that we're aiming for that can actually set up membership discounts with all the pharmacies across the province. And it doesn't stop there, right? Because we can target the other provincial pharmacy associations as well. And all of that is even more expedited with our channel partner, Pharmacy Access Solutions, which she's already in many, many stores nationally, which when we're partnered and we sell with a given solution that's already in the market, it's very easy to expand on that current market base, right? It's easy market access, which can only grow from there because it becomes validated with the current clients. And from there as well, we can also target other vendors as well. So we've already been engaging with other pharmacy management softwares to actually offer a discounted price for the joint solution across all pharmacies that use that pharmacy management software. So I like to think about it as kind of a team tackle approach with other fellow partners that just puts the store right into the shops really, really easily, right on the management software that they're already using.
Okay, and so with your service, how are you going to defend against would-be competitors? What's your moat look like?
So the moat is the fact that we're actually having a unique integrated solution, given over 90% of pharmacy management softwares in Canada, given our unique partnership right now that we have with Pharmacy Access Solutions, because we can offer this solution immediately integrated, whereas other startups would have to, worry about all the integrations. They would have to think about, okay, we have to identify, okay, the budget here and do the technological requirements, which will take a considerable amount of time. Whereas our unique partnership gives us the ability to offer this integrated solution at a much quicker and more efficient executable way. On top of that, our algorithms as well have been, sifted for, well, it's been 8 to 12 months now that we've had a team of pharmacists just thinking about the best way to show the algorithm. And we've just went through all of the Canadian guidelines for the minor ailment conditions, and as well with our partner, MedSask, that has been providing this, Canadian credible data. We have been able to really defend the fastest way possible to get these services done, right? So I would say it's our experience in the field as well as our knowledge that we know that this is the fastest, most best way to do this as well. So I'd say that's probably our differentiating factors as well.
Great. Jennifer?
Great. Maybe moving over to Alex now. Do you have some questions?
Yeah, so I had a couple of questions. So first of all, and just kind of building off of the moat question, it sounds as though where you're focusing is essentially being first to market and being in the stores before another competitor is able to catch up. Is that a fair summary of how you're planning to defend? Because I always ask, one of the questions is, if somebody like Google were to say, hey, this is an interesting space, let's go build one of these, and they have the ability to throw those resources at it and tool something up very, very quickly, where is your ability to defend, or your barrier to entry against something like that? IP is obviously one way to have that barrier to entry, but the other, and I think this is maybe where you were getting at, is that you're going to be already in there integrated with the existing systems before that sort of ramp up could happen. But I wanted to get your thoughts on that.
Yeah, so that's definitely considerable, but I wouldn't say that's the whole differentiating factor. I think the experience that our team carries, all of the insights that we've gathered so far up to date are definitely, I would say, unique, right? Because for a big player to come in here, which we've had discussions with, that the big pharmacy management softwares that own the majority of the market, they were coming to us asking, hey, what are you guys doing? Because we've been doing this for a year. We've been, basically working at this solution. And the fact is, it is difficult to find a really easy and fluid way to diagnose a patient, because you got to try it. You have to have, it has to be out there on the market. You have to have data to support. So I think that's a big, it can't be done easily. It has to be done with practice, with pharmacists that are passionate like us, that have the insights, that have the networks to understand the problem, and that can actually, work on delivering it in the most efficient way for the end user. Because usually those big companies don't have the end user in mind. They usually think, well, if it works, it works. I'm not an end user. I just want to sell it and get it out. But the thing is, our team has that fundamental idea of what can we do for our end user, because we are the end user. And so we have this. Yeah.
So if I'm summarizing correctly, what you're saying is your differentiator is this is a solution that's built by pharmacists for pharmacists?
That's part of it. It supports the user interface and the ease at which it's used, because other vendors, for example, we've seen, us at PharmAssess, we would have built it completely differently, because we see, well, there's no means of billing in this bill code. I mean, I have to now go back and I have to redo it. And so the fact that that is a problem, and the fact that our team is able to actually use those problems to our advantage to design solutions that don't have those inherent flaws, then I think that's another differentiating factor. But definitely going back to it, first to market helps, I would say. Having an integrated solution right off the start, I think that's a blessing for sure. And I think the networks and the knowledge behind our algorithms, the partners that we have involved, really support a really fluid, easy to use solution that I think will benefit society at large for sure.
Great. Thank you, Thomas. I have some quick questions for you. First of all, as a consumer, how would I know what a minor ailment is and to approach the pharmacist versus my doctor? How are you going to educate the public?
Yeah, so that's a really good question as well, right? When we start thinking about the minor ailment solution, we start running into, okay, so what will the patient experience look like, right? And so what we've seen in provinces in Canada that have already been doing this is that majority of the time, patients would have somewhat of a pretty good idea of what they're coming into. They would say, I have this rash, and I've been, 90% of people, what do? They go on Google, right? They say, hey, I got this rash. What does it look like? And, pharmacists behind the counter are always like, yeah, I know that's what Google says, right? But then when it comes down to it, we have this interface that we're able to, discreetly see. And I was doing this earlier today at the pharmacy, where I was dealing with a patient. I kind of wish I would able to have this, easy to use interface of systematic questioning to identify actually what it is, and sifting out all that unnecessary information. But the thing is, if we actually, offer this solution to patients directly, which I think, Jennifer, your question is, how would patients remotely know that they have a minor ailment? So majority of the time, they would know that, okay, I think I have, maybe it's like an acne, outbreak or something. I think I need to go to the pharmacy, or I know that this pharmacy has remote access through PharmAssess. So I'm going to go ahead and I'm just going to type in my pharmacy. Maybe it's, GoodRx down the street, go on the website, and I can just, access the PharmAssess link on the pharmacy's website, which we can provide the pharmacy when they sign up with us. So then that way patients can actually just easily go to their targeted pharmacy and through us access the minor ailment portal, which easily shows them what they're eligible for.
Great. And is there a list of what those minor ailments are?
Yeah, for sure, Jennifer.
Or each
That's right.
Okay. And then how many of those would direct you toward drugs versus an OTC solution?
So actually, what we've seen in the publications is that almost every condition saves cost when it's treated with an RX. And that was absolutely surprising when I was reading through the research of it, because it shows that, the RX medications, and a great example is cold sores. You take a prescription cold sore medication, valacyclovir. I mean, that just is so much more effective.
Does the pharmacist, so for all of those, I'm sorry to rush you along here, but do the pharmacists have ability to give RX for how many different minor ailments? Is it 10 things they're allowed to give RX, or?
It depends on the province. In some provinces, they can give up to 40, 50. Actually, Alberta has unlimited prescribing rights, which is fantastic.
Oh, right. Okay, great. And then I think I might have missed it in your presentation, but you mentioned that one important factor was your alliance with PharmAssess Solutions. I missed that. Is that a separate company?
Yes. So Pharmacy Access Solutions is one of our partners that we're engaged with, and we're very, very grateful to be able to be to have a joint, as you would say, alliance with and sell our solutions together. We think that there's a lot of synergy.
What do they do? What do they do?
They're a pharmacy software vendor. They've been around for
software vendor. Okay, great.
Yeah.
You'd be perfect merger candidate because your names are almost the same.
Isn't that right?
Yeah. Just do another quick round of questions. John, did you have any follow-up questions?
Well, actually, you kind of touched on it there, Jennifer. So to the extent you're comfortable, what is the relationship type of arrangement that you have with them? And I guess the question ultimately is, if they changed ownership or decided that this wasn't working for them anymore, is there a contingency for that, or that won't happen because?
Yeah, I mean, that's a fair question, but just to respect confidentiality, I mean, the most I can probably go into it is just that those things have been accounted for in an agreement, for sure.
Yep. Okay.
Yeah, but thanks for your
question.
Fine.
No, that's good. As long as that's been covered, that's good.
Yeah, and just to follow up, you're bringing the scheduling and the algorithm. Is that what you're bringing to them?
That's right. Yeah, we're actually phase 1 of the rollout is targeting the COVID vaccinations, which is just an enormous, burden right now. I was dealing with that all day today at the pharmacy, and that's right. That's our first launch, and then we're going to expand to minor ailments after.
Okay, very good. And Alex, do you have any final questions?
Yeah, just one. So it sounds to me like what you're putting together there is like a decision support system for the minor ailments.
Yeah. It provides basically an end-to-end solution for the whole workflow, and with respect to minor ailments. Yeah.
Is it helping the pharmacist to make the diagnosis as well?
It provides the pharmacist with possible symptoms of that condition, which greatly helps the diagnostic procedure. Right. Just to give you an example, if I was there and the patient comes up to me with a nail infection, which happened today, I wish I had those symptoms right in front of me. So then I wouldn't have to read, chunks of paragraphs on my pharmacy reference system. Because if I had those suggestions, then I would be able to just hammer them right off the bat, and I would say, okay, it looks like this, or then I can have a different category similarly, organized with the other likely conditions, and it would just be so much easier in my interaction earlier today.
But it's so fundamentally though, it's still supporting the pharmacist in making the ultimate diagnosis. It's not trying to produce an outcome on its own.
Exactly right. Yeah, that's right. Yeah, it's just a supportive technology for the pharmacist. At the end of the day, the pharmacist is still making that diagnosis themselves.
Okay, thank you.
Yeah, good question. Yeah, thanks.
Great. Well, thank you very much for your presentation and answering our questions so nicely.
Oh, fantastic, Jennifer. Thank you, Alex, John. It was a pleasure to meet you, and thank you for the opportunity to present.